Is microneedling an effective treatment for hair loss?
There's a lot of interest in microneedling and dermarolling on the internet as a way to treat hair loss. Although dermarolling may appear to be popular, it doesn't mean it's particularly effective to induce hair growth. I'll discuss my experience and perspective with microneedling as it applies specifically to hair loss treatment. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I've performed hair transplant surgery throughout my career to help people suffering from hair loss. I'm also the founder of Tricostem Hair Regeneration Centers. Tricostem Hair Regeneration is a standalone, non-surgical treatment for hair loss, which I developed while using advanced wound healing technology to improve the outcomes of hair transplant surgery. Since 2011, we've been treating hundreds of patients every year from around the world with our Tricostem Hair Regeneration system. When I first started using wound healing technology for Tricostem Hair Regeneration, I actually used microneedling. It was to induce a controlled injury in the scalp. I was hoping to achieve better hair growth results based on the possibility of increased adult stem cell recruitment induced by the scalp injury from microneedling. Although initially I felt that this approach may have had some benefit, I later observed that microneedling was just not necessary for our treatment to be effective. In addition, microneedling appeared to actually induce hair shedding, possibly as a consequence of trauma to the existing hair. The basic principle behind microneedling, whether it's for skin rejuvenation or for hair loss treatment, is to create a controlled depth injury to the skin in order to induce a healing response. In the skin, the body's response to injury is to generate collagen, a protein needed in the skin for structure and strength. Now, there is well-established evidence to support the utility of microneedling for different conditions, including wrinkles, acne scars, skin discolorations. I have a lot of experience with microneedling for the skin in my practice. However, I currently prefer alternative strategies that are more effective and don't require any downtime. As far as hair growth is concerned, an injury can potentially stimulate hair growth, but only the growth of what's called vellus hairs, which are fine hairs that don't grow long or thick. These hairs are often not even visible without magnification. Unfortunately, a lot of people buy devices like dermarollers online and try to DIY their own scalp treatment. Depending on the depth of the needle, you can unknowingly injure oil glands, sweat glands, and hair follicles, thereby doing more harm than good. Just think about it for a moment. If these dermarollers worked so well, there would be no need for hair transplant surgery, and there would be no one who would be bald. I'm aware that in the medical arena, microneedling is often being done with PRP or other topical applications to stimulate hair growth. If you're considering microneedling and topical treatment, you should probably ask yourself if this approach is the best way to help your hair loss. When we perform a treatment at Tricostem Hair Regeneration, we're using PRP or platelet-rich plasma combined with extracellular matrix by ACell, customized to your specific hair loss category. We help people with hair loss by reactivating hair that's in a prolonged resting phase and thickening hair that's thinning. For the typical patient who has male or female pattern hair loss, we perform 2 treatment sessions approximately 18 months apart, with results sustaining for 3 to 5 years and even longer. We follow our patients every 3 to 6 months and take photos to show you your progress. I also manage hair loss with other medical options and recommendations as are appropriate to your situation. As mentioned earlier, this system has been well established as highly effective since 2011, with experience, as mentioned earlier, helping hundreds of patients a year from around the world at our offices located in New York City, Long Island, and Northern Virginia. If you're experiencing male or female pattern hair loss, it's important for you to understand your specific type of hair loss and pursue the most effective strategy that's right for you. I have found that many people take a blind shotgun approach where they buy a lot of shampoos, oils, lights, supplements, and devices being sold on the internet. Unfortunately, these products are not as effective as the claims and testimonials that accompanied them when you added these items to your shopping cart and purchased them. At this time, I can report that we have very successfully helped male and female pattern hair loss or people with androgenetic alopecia using Tricostem hair regeneration to achieve maximal scalp coverage for long as possible, factoring in the limits of your genetics. I hope this information from my experience helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.